Well, I've got another case of multiple surgeries performed on multiple nails, and yet pain still remains. I'll introduce you to a new term I learned and what it means, plus the plan moving forward to help this client. So stay tuned. Hey everyone, it's Rachel, aka the Nail Therapist. Welcome back. Today we're going to look at a girl who has something called onychophosis, which just means a fancy term for there's an excess amount of skin that grows around her nails. And it's usually something that's hereditary, so not something we can necessarily change with products, but we're going to give it a good shot and figure out if we can help reduce the amount of skin that builds up over time. This client has had multiple ingrown toenail surgeries on both of her big toes and I believe both of her second toes on each foot. So she's been dealing with pain for a long time and she still has some discomfort even after all of these surgeries. You'll see when we get into it further what is actually causing the pain, and it, spoiler alert, it's not actually nail. So we can talk more about that in a little bit. But overall, she's got healthy feet, so really we're just going to focus in on what I'm doing to help alleviate her pain around her toes. If you're new to my channel, welcome. I've been running this channel for a couple of years now, and I love giving you guys content where you learn something new each time. And it's actually challenged me to learn more as I've gone along as well. So thank you for supporting my channel, and I hope you find it interesting. I am a solo entrepreneur, and I work out of a studio in Leesburg, Virginia. And my whole mission is to help people using organic and non-toxic products. So if you are looking for a product, you'll probably hear me recommend things that are more on the non-toxic or organic side of things, as opposed to the mainstream things that you might see other people use. So this client also takes matters into her own hands at home and does a lot of clipping and filing and polishing with gel polish at home. So you'll see that some of the tops of the nail look like they're damaged because the polish will peel off and take layers of the nail with it. And also the sides of the nails look like they are not filed very well because it's hard to do on your own and you don't know what you don't know. So while I'm giving her her pedicure, I am trying to educate her on what the filing needs to be like in order for the nail to successfully grow in more healthy and alleviate some of her pain. Because some of her pain, I think, is coming from the way it's been filed in the past, whether it's from her or somebody else she's gone to see for a pedicure. as I'm working on her nails, look at the skin around her nails surrounding it and ask yourself is if it looks normal. And you'll see over time what I mean, especially after she's been soaking for a little bit. I'll point it out a little bit more later because one of the problems that she has is an overgrowth of skin around her nail plate. And it's deceiving because it doesn't look like it's super overgrown when it's dry. But watch later for when it is wet and saturated with water, and you'll be able to see a lot more clearly what I mean. So even though the toenails look wet, she hasn't actually been in the water. Right here, I just put on a drop of the callus softener on each of the toes. So that's why her nails look wet. The callus softener I use is called Sachet Callus Care. You can use it for cuticles as well, which is what I'm doing here, and the bottoms of the feet for really thick calluses or just regular calluses that you have on everyday people. There's multiple ways to use it, and it is wonderful, but it is only available for professionals. So I'm sorry to all the home DIYers. You can't buy it, at least not yet. But if you're a professional, you can, and you can go to CJ Center for Beauty and learn more there. She sells it through her website. I think that might be the only place that you can get it. I haven't looked into that, but that's where I get it. You can see the tips of her toes have that built up skin a little bit better on this foot. You can see it, especially under the third toenail and the tip of the second toenail. You sort of see that dry ridge that is happening where the nail was pressing into the skin before I clipped it. So that's going to be part of the process of relieving her discomfort, is removing the thickness of that skin. Every night, this client has been putting on 40% urea gel on all of her toes, toenails, and skin together. That's her nightly thing. Now, if you don't know, when you have a high concentration of urea like that, anything above 40%, it becomes what they call keratolytic. So it starts to break down keratin, and which is appropriate for her on some level. However, she doesn't need it on her actual nails. That can end up softening the nails itself and causing issues with the strength of the nail. She only needs it on the skin around her nails. So we talked a lot about that. And the other component to using the urea is then you have to exfoliate. So you're softening the skin over the course of several days using the 40% urea gel. Okay, fine, that's good. But you also need to exfoliate the skin off. It doesn't just kind of peel off or fall off on its own. You have to use something to exfoliate the skin. And so she did buy a very inexpensive e-file that she's been using at home, although I wasn't clear as to how she was using it, whether it was on her nails or on the skin. I'm not sure. She did send me the link and I looked at it, and it did come with like sander bands. So I recommended to her that she buy instead better bits to use in order to exfoliate gently the skin around the nails, still using the 40% urea, but then also once a week or so going in with the e-file and really exfoliating down around the nails. So funny, I just got an email from her, and this is what she's been doing since I saw her. She wasn't able to stop using the urea because her skin was just getting too thick. So she's been pushing back her cuticles after the shower, then following up with jojoba oil on the nails, then using a 10% urea lotion, and then sealing everything with Vaseline and Aquaphor. So her nails are going to get stronger and her skin is still going to be hydrated. And then now she's going to be adding in the exfoliation with the new bits. On the inner corner here, right here, is where she still has some pain on this toenail. So I'm trying to use the ingrown toenail rasp to go in there and lift out any remaining spikes, if there are any, or scar tissue, or just skin in general. One of the things I've learned in these types of clients is that the skin can like to hide underneath the side border of the nail. It kind of scoots underneath there and it tucks under, and you have to sort of push it out and coax it out to be able to really clean up the area and relieve the pain from that skin being trapped underneath the side of the nail. This skin right here is hardened, and so I am more inclined to think that it's scar tissue from the surgery that is just remaining there. And you'll see it in other corners as well. It's a very common thing to find after especially multiple surgeries. In this corner, there is no nail left in that sulcus where I typically find a pocket of something. It's just scarred down right there at the corner of the nail. But she does still have some discomfort. So I'm trying to see if any skin is going to come out from underneath the nail along the side there, because it does take a little bit of time to sort of coax it out to see if it actually has something or not. You can't go 1, 2 passes and say, oh, there's nothing there. It sometimes takes 10, 10 or more passes to try and get that skin to release from underneath the nail. And so you'll see a little bit come out. The other side is where the money shot is, though. So in just a second, you're going to see this little tiny, I don't know, flag of skin sticking out right there. That is what was bothering her. And again, you saw all that I had to do to unveil it. So when you're doing these kinds of pedicures, don't give up. Keep talking to the client and ask them, are you still feeling it here? Do you still feel anything here? Is the pressure right here? Get an idea of exactly where they're feeling the pressure, because that's going to tell you where the problem lies. So I came up with my own personal theory about what is causing that specific type of pain. So as you can see in the back corner there, the nail is cut more narrowly than further out towards the tip. And there's a slight area of her nail bed that is exposed. And so the nail bed creates nail cells if it's alive, and just like any other layer of skin. And the top of the nail bed likes to attach to the bottom of the nail. And that bottom layer of nail drags forward along the nail bed. And so that skin is sort of taken along for the ride, if you will. Well, when there's no nail on top of the nail bed, then the layers of the nail bed just build up over time because there's nothing on top of it to attach to. And so it's my theory that some of those layers of nail bed get lodged underneath the area of nail that's not attached, and that is what you end up sort of pushing out from underneath the nail, where it is not fully attached. You'll see it happen on this nail as well, and that's why it's really hard to find, because it's tucked underneath the nail. All right, so now this foot has been soaking for a few minutes, 10 minutes or so, and you can see around the distal edge of the nail and the side walls, the skin is sort of plumped up a little bit more than normal, and you can see more so where that dead skin is thickened around the nail. So we're going to try and do our best to exfoliate all of that off. And this side has a lot more hidden gems underneath the sides of the nail as well. So I'm using the back smooth side of the pusher here to push out the skins. I didn't want to irritate the skin too much using the serrated side, so I'm gently pushing back using the smooth side and trying very hard not to actually push the pointed part into the skin at all. All right, so this foot has been soaking a little bit longer, and I wanted to go in there and along the edge here and just make sure there wasn't something extra I didn't pull out. But as you can see, I irritated the skin pretty well right there. So it's not quite bleeding, but it was like on the verge. So I went ahead and grabbed a sterile gauze and just placed it on top of it, just in case something came seeping out, which it didn't. But I just wanted to have it there for safety and sanitation reasons. So in case you're wondering, what the heck is the gauze thing doing? What am I doing there? That's what I'm doing. And again, you can see now the whiteness of the thickened tissue after it's been soaking for a long time, which clearly delineates exactly where the skin is just puffed up and thicker. There is another YouTube account that I follow that maybe some of you also follow, because she's like got 2 million followers, and I think she's in Brazil or someplace in South America. She's a podiatrist down there, and she does like minor surgeries and yada yada. But she has a lot of people who come to see her exactly for this thickened skin around the nail. And what she does, which I cannot do, is apply some sort of acidic treatment to the toes, and then lets it sit on there with the gauze or whatever for, I don't know, however many minutes. And then she comes in and basically peels off all this skin that I'm having to physically work off. So in America, as a nail technician, I cannot apply any kind of acidic treatments to the skin. I can't treat the skin. And so that leaves me sort of, um, you know, in a bind to help my clients better, because I don't really think that podiatrists up here do the same things that are done in other countries either. They seem to be just really surgery gung-ho and not so much treatment gung-ho. I hope I'm wrong, but that's all I've really seen. I wish, as a nail technician, we could get further training to do things that this woman I've seen do in her videos, but alas, it's probably never going to be the case. This type of problem is also one of the reasons why I continue to use water in my pedicures, because the water does, one, soften the skin and the nails quite a bit to make it easier to work with, but two, without the water, you wouldn't be able to see the exact location of where the thickened skin is. So I find that to be a benefit. I know that there are lots of people out there who really just are anti-water at this point, but I think for me, I think I'll always have water in my pedicure treatments. I just, one, it's really relaxing for my clients, but two, there are many benefits for me as the nail technician to have the water as part of the service. I'm also not going to show you the foot filing that I am going to do after I'm done with her final cleaning here. And I use the foot file very gently along the tips of the toes as well. So in the final pictures, you'll see the fresh, healthy skin underneath the tips of the toenails as a final result. This is a great angle because you can see exactly where the nail is trying to grow and where the nail was filed incorrectly along the groove here. It should be coming straight down from where the groove is at the sulcus there, but it isn't. It's cut inward from improper filing. So we're going to try our best to let that grow in naturally. Now that we know that there's no spicule, it's not going to run into the skin. The only problem is all of the excess buildup of the skin around the nail. That might be an issue. So hopefully over the coming months, we'll see some increased growth along the sidewall and we'll have a new sidewall reestablished. You thought we were done with this side, didn't you? No, 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 no. If you're OCD like me, you keep going back until you are fully satisfied if you have the time. And you will see in just a minute why I kept going back. I hope that big release was as good for you as it was for me. Gosh. I never thought this kind of thing would be the thing that I actually like enjoyed when I was younger. I never thought about doing nails when I was younger, ever, until I just fell into this job and been in love with it ever since. So it's fun for me. I hope it's fun for you. After we are done cleaning up her cuticles and removing as much of these hidden gems as we could, I did use the foot file on her as well, and then hydrated her skin. We talked about what she needed to do at home as far as continuing with the urea and exfoliation practices. And so hopefully the next time I see her, which won't be until September because I'm completely booked up for the next couple of months, we'll have some good results to record, and I can share with you when she comes in again to see me. So thank you all so much for hanging out with me today. If you have any questions that I didn't answer or I maybe confused you about something, please put them in the comments section. I'm happy to answer and have a conversation with you. As part of the fun for me in doing this is actually communicating with you all. So until next time, I hope you guys have a wonderful July 4th weekend and be safe out there. I'll see you next time. Take care.